So hi again for those of you who have just joined. My name is Livy Tracek. I will be your host today for the webinar. We so appreciate everyone joining us during a really busy time of year with school wrapping up. And we want to thank all of you for the really extraordinary work that we know you have done in this past year and a half. We know it has been a really challenging school year. We also want to welcome you specifically to this webinar, which is called Addressing Implicit Bias and Disproportionality in Social, Emotional, and Behavioral Assessment. Today's webinar is brought to you by EdWeb and Illuminate Education, who is the provider of the Social, Academic, and Emotional Behavioral Risk Screener. This K-12 Universal Screener provides educators with specific attributes and behaviors that they can look for in their students that demonstrate their skill level with social emotional competencies that support both academic development as well as mental well-being. We have with us Dr. Katie Eklund. She is an associate professor in the School of Psychology program at the University of Wisconsin-Madison. She's also the co-director of the Social Mental Health Collaborative. Prior to entering academia, Dr. Eklund worked in public education for 10 years as a school administrator, school psychologist, and school social worker. She is currently a nationally certified school psychologist and licensed psychologist. Dr. Eklund's research focuses on school mental health, including early identification and intervention for children with behavioral and social-emotional concerns, social-emotional learning, school safety, and equitable outcomes for culturally and linguistically diverse students. Also joining us today is Dr. Janine Jones. She's a professor in the School of Psychology program and Associate Dean for Academic Affairs in the College of Education at the University of Washington. As an engaged scholar and licensed psychologist, Dr. Jones is dedicated to implementing research that informs clinical practice. She believes the path to meeting educational and social-emotional needs of children and families lies within a cultural context. As a practicing psychologist, she has served a diverse population of more than 250 children and families in assessment and treatment. In her 20-plus years of providing clinical services and conducting research, Dr. Jones is at the forefront of scholar practitioners to identify effective approaches for addressing the mental health needs of children and families of color. Without further ado, let's dive in. Dr. Eklund, you may begin.
Great. Thank you, Livy, for the warm welcome. Dr. Jones and I are excited to be here with you today. Thank you for taking time to join us. As many of you know, schools around the country are focused on ways to help support children with emotional and behavioral challenges, especially following the pandemic. However, there can be challenges that arise when asking educators, parents, or others to assess children's behavior, which we all do through our own cultural lens. We're here today to talk with you more about how we can address issues of implicit bias that arise for each of us and how that might impact the behavior assessment process and conceptualization of a concern, as well as how to begin to address rates of disproportionality that exist when providing supports for children who might have social, emotional, and behavior concerns. So if you hear the term today, SEB concerns, we're really talking about social, emotional, and behavior concerns. So our objectives for today, we plan to discuss considerations around implicit bias and how to ensure students receive equitable support, how social, emotional, behavior assessment data can be used to consider which students need what type of support, what are methods for reducing rates of racial, ethnic disproportionality and behavior risk identification, and then ending on strategies for engaging in culturally responsive assessment practices. So it's important to start with the why. Why are we here in order to get to the how and what we can do about this? The World Health Organization has defined the current state of child and adolescent mental health as a public health crisis. They've indicated that child neuropsychiatric disorders have become one of the 5 most common causes of morbidity, mortality, and disability. Within our research team here, we talk about this 2020 phenomena, that 20% of children have some type of social, emotional, or behavioral concern that warrants help or support at school. However, out of that group of students, only 20 of those students receive support for those concerns. So obviously there's a large gap between kids who demonstrate mental health or social emotional concerns and those who actually receive services for that support. It's also important to note that there are significant disparities in youth mental health service delivery, especially for Black and Latinx students. We know that racially and ethnically minoritized youth experience persistent disparities at various levels of service utilization. So that includes being identified for particular concerns, thinking about service utilization, the quality of treatment that they receive, engagement in therapy, and the outcomes associated with those services. This is especially troubling as racial and ethnic minority youth are more likely to experience childhood trauma and things like poverty, community violence, and discrimination, which may increase risk for mental health concerns. Further, in terms of identification, there's conflicting evidence concerning the identification of racially and ethnically minoritized youth in disability categories specifically, which we'll talk more about today. The combination of these disparities in mental health service delivery and outcomes really highlights a pressing need for accuracy in the identification of SEB concerns, especially among diverse student populations. Okay, so let's dive into behavior assessment practices and think about how children are assessed for SEB concerns within schools. If we were all sitting together today, I would likely start by asking you, how do kids at your school currently receive help or support for mental health concerns? So if you have a student who's demonstrating social, emotional, or behavioral concerns, how do you find out about them? If you're counselor, the school psychologist, or social worker at your building who provides mental health services, what does that look like? And so certainly you can see here in these white circles, this is through a teacher referral. You might already have universal screening procedures in place at your building. Hopefully you're lucky enough to have school-based mental health supports and access to enough individuals who can provide services to kids. Perhaps you have a problem-solving team in place at your school where kids can be referred if their teacher or other educator at school has a concern, or perhaps methods like office discipline referral data. There's lots of ways that we can do that. Research has shown that teacher referral within schools is typically the #1 method by which kids are identified who have mental health or SEB concerns. However, we know that sole reliance on that can be problematic for a number of reasons. Many schools consider or refer or rely on traditional refer test place models, and that can be problematic if you're just relying on teacher referral for a couple reasons. We know that teachers really differ in their ability to work with students. There's a great article that came out by Gerber and Semmel in the 1980s about teachability, right? That teachers have some perception of what type of students are teachable and that they connect with. And this can often influence teacher-student relationships and interactions, and ultimately student learning and achievement. We also, many of us, were not trained to know how problematic a behavior might need to be prior to referral. Right? I can think when I was working in the schools, we had 2 kindergarten classrooms, and both had seasoned kindergarten teachers who had been working with kids for a number of years. In one classroom, the teacher really had the mindset of, I want to take care of my own students. This is their first experience with school, and didn't really call on outside support professionals for additional help and support. And the teacher in the other classroom, I think, may have referred, a quarter to a third of our kids for a special education evaluation before the end of the year. And so really thinking about the differences between those 2 classrooms and looking back to think, I thought we had pretty similar procedures set up at school for which kids might receive services, or how we identified students and would refer students to the problem-solving team, but certainly that operates much differently in practice. We also know that social, emotional, and behavioral are often under-referred or referral is delayed. There was a study that looked at the differences between academic problems compared to behavior concerns, and found that on average, if a student has a problem, for example, with reading, they usually receive services for that reading concern on average about 1 to 3 years, right? Which is problematic in itself. But when we look at behavior concerns, on average, research found that kids looking back, it could take on average 5 to 7 years later from when they demonstrated the concern to when they actually received help and support for that. So it's important to think about what are methods we can do to ensure that all kids are being successful and aren't encountering barriers to learning. Okay. So when kids are referred to a problem-solving, we know, or a school mental health professional or other specialists for help at school, there's a wide range of variability in what they could be referred for. It's important, and I referenced this a little bit earlier, it's important to understand why a problem is occurring as part of your behavior assessment plan or as part of that problem-solving referral process. We really have to start with that why to get to the how. If we get the why wrong at the initial offset or at the initial onset of the problem, then that can really undermine everything else that we might be doing. If we look at one piece of evidence in our assessment process or one teacher's feelings about a student or observation of a student, this can really directly and indirectly influence our decision making and our next steps and how we proceed and get involved with the students. We Cultural differences exist for most, if not all of us, right? Cultural differences is defined as differences in beliefs, values, or identity, and can play into our own subjectivity about a problem. If we think about the majority of practitioners in our field, we see that 70 to 80% of our teaching force and educators who work within schools are white. And if you think about the students that we serve, students ages 5 to 18, where over half of this group is non-white. This suggests that as a white practitioner, I'm likely to work with a student who is from a racial and ethnic group who's different from my own. And there's a lot of subjectivity in the assessment of behavior concerns. If you think about all the ways in which we gather information about how to help support a student, right? So this might include filling out a behavior rating scale, conducting an observation of student behavior, thinking about student engaging in an interview with a student or with a parent or a caregiver. Each of those relies on an informant or an observer to make an assessment of a student's behavior. So it's important in that process that we consider each of our own biases, stereotypes, and prejudices in that process. We're going to create culturally relevant practices for all kids. And note, when I say culturally relevant practices, those assessment practices aren't just kids from marginalized backgrounds. They're for all kids. This is what we would consider best practice for all kids, not just BIPOC youth. So as a white woman, it's important for me to step in and recognize my own privilege, my own positionality in that interaction, how I perceive another person's behavior, what I see or read or interpret when I receive a referral on a student who may need help or support from me as a school psychologist or a school social worker or counselor, anybody, teacher who's involved in that support process, it's going to have some level of implicit biases. So being aware of them, calling them out, and working to change them is what we will talk about. So I'm going to go ahead and turn it over to Dr. Jones to step into this a bit further.
Thank you, Katie. Where I'd like to start is really for us to back up and step outside of ourselves for a minute and think about our fields. So if we know that our history has influence in the way that we think and the way that we interact and the way that we make decisions, it's important to recognize that we're actually trained to think biased in a biased way. So first think about in psychology that the practice of psychology has beliefs that encourage us to really value things like superiority and meritocracy and even heritability. So we think about what is better and who's the smartest and what is the ideal that we're striving for. That is really where psychology is grounded. So we have many assumptions within psychology that are even based on refutable explanations of racial differences in intelligence. We can't deny that that's where our origins began and where our tests that we use were originally developed with these beliefs. Our field is really designed, you probably know this, it's designed to be from working from a deficit perspective. We are brought in when there's a perception of a problem. We're brought in to be able to come up with solutions to overcome a weakness or a deficit that we perceive in a person. In the same time, we recognize that our differences and uniqueness, we kind of interpret it as bad, unfortunately. That's kind of the way that we're socialized into our field. And so when we take these perspectives and realize that if we are kind of lining up against what we think is common or what's expected, everything else is perceived to be pathological. So you have to actively work to not think in a biased way if that's the origins of our field. But I'd like to kind of give you an example of really how our biased thinking influences us. So I like to show that and ask the question, what's happening here? Car thief or lost keys? When you watch that video, we interpret that event based on our experiences. In this scenario, think about, we've had limited information. We have no sound, we have no context. We're just observers to a situation. So what we do is we align with what's familiar. So what was happening there, I watched that video and I can remember before I had a car that had a remote, I could easily identify with the possibility that the car keys were lost or locked into the car, and that I may have come back multiple times looking for my keys and hoping that they were going to appear in the same place that I'd already looked multiple ways. And I could identify with this man as possibly experiencing the same thing. However, you may have watched the video and perceived a car thief. Now, you have to understand that our society has socialized us. They have socialized us to perceive Black men as committing crimes or being unsafe. And so it would be natural for some people, for most people actually, to have that counter interpretation, the car thief rather than lost keys. What that is implicit bias at play. So what's happening is these are culturally based assumptions that we make in a millisecond that guide our behavior. They're really shortcuts. Our brain kind of creates them so that we can process complex information as efficiently as possible. We're actually hardwired to fill in the blanks. So very little information, we filled in the blanks because that's exactly how we operate. So with that limited information, when we have limited information, we usually do things where we'll perceive a situation negatively because the other person that we can't really identify with doesn't make sense to us. So if you felt bad that that you assumed that he was a car thief, you shouldn't, because really our society primed you by creating a context where we are constantly being shown images that are counter to what might have been experienced in this video. So in order to fight against implicit bias, because I said it happens in a millisecond, you can't really control that. So in order to fight against it, we have to intentionally fill in the blanks by seeking additional information before acting. This plays out in assessment in the same way that we can make assumptions, or the people that refer to us make assumptions, and then we act on those assumptions before we really collect the information that's needed. So what we have to do is remember that our behavior is powerfully guided by what we expect to be true. And implicit bias plays a big role in our expectations. Okay, so if we know we have implicit biases, how does it affect our practice? It really, really does. Here's some examples. We do things like we interpret a student's need based on our own experiences. Sometimes we'll have cultural blind spots where we miss kind of the silent struggles of BIPOC youth. And that I'll talk about later on, what some of those silent struggles are. We allow our systems and structures that are already designed to be exclusionary to guide our decision making. We have to really think hard about what are the structures that pre-existed that have already marginalized groups of people and push back against continuing or perpetuating that cycle of marginalization. We also perpetuate those values that I mentioned earlier of superiority, inheritability, and meritocracy without recognizing or acknowledging that these are also systems of oppression. That's really important, is recognizing somebody is oppressed in each one of these values. And then we trust our deficit model as the gold standard for how to help people. We have to recognize that if we turn that deficit approach on its head and look for strengths and work within strengths, we're much more likely to be able to serve people from historically marginalized or oppressed groups. So what do we do and how do we do it? I'm going to send it back to you, Katie.
Great. Thanks, Janine. So one strategy for identifying social, emotional, and behavioral needs of children and of students in our schools is to really think about what are those based approaches. That is, how do we ensure that all students who need support in a school or in a district receive equal opportunity to help and support, not just those necessarily who are referred for consideration. All right, so we were talking about population-based approaches, and universal screening is one strategy to identify kids who might be showing early signs of emotional and behavioral risk. This is seen as a more systematic or structured approach to early identification that has the potential to improve identification accuracy. In this method, if this is new to you, each student in a classroom, in a grade, in a school is assessed to determine if a given student is elevated on behavioral and or social emotional concerns. And from there, we're able to aggregate data to look at the percentage of students in a particular classroom at the grade level or across a school or district to determine what percentage of students might be demonstrating some type of concern. The goal in screening is really to identify behaviors, a wide range of behaviors, both those that are apparent to an outside observer, like a teacher or parent, as well as internalizing concerns, such as anxiety or depression, that are sometimes more difficult for outside observers to key in on. So similar to how we screen for vision, hearing, and often for academics now, the goal would be to screen for behavior concerns, really trying to find a structured method by which teachers, parents, and or students themselves can be able to share their concerns. Research, especially that over the last 2 decades, has really shown us that screening has the ability to predict outcomes. And you can see some of the evidence that's on here. The goal in being able to screen, right, is to provide early intervention. I sometimes joke in schools, we do a great job of collecting data. I don't know if we always do a great job of using the data that we have available to support kids. So really thinking about what data do we have available? And then again, what other additional data might we need that isn't available, such as something through screening. So our short and long-term goals with screening would be not only to identify students and to think about systemic wide supports that we could provide, but also longer term to think about how do we decrease academic failure, how do we increase student well-being, and how do we improve educators' ability to effectively respond to student concerns that potentially could come up. So there are a number of considerations that one would want to have in selecting a screener. First of all, if you're thinking about using a screening measure, we'd want to make sure that it assesses key variables, that it's representative of key domains of student functioning. So this would include aspects of social behavior. How do kids get along with one another? How do they get along with adults? Emotional behavior, right? Thinking about some of those more internalized behaviors such as depression or anxiety, as well as things around academic enablers. So not just academic skills or how a student does in reading or math, but really thinking more broadly about, do kids want to come to school? Are they engaged in learning? Research suggests that we can best predict future behavior and potential mental health concerns by considering not only behavior problems, but also student competencies. What are they doing well? We want to know about student strengths as well. So it's not enough to know if social and emotional problems are present, but we also need to know if competencies are absent. So study skills, social skills, those kinds of things that we know are important to students being able to function in the world. Screening needs to be quick and cheap. We want it to take a couple of minutes per student and to be not cost prohibitive for a school or resource intensive. So really thinking about how are you investing in something that's going to best support students who might be struggling around behavior concerns. We also want to make sure that it's psychometrically adequate, that it's valid, reliable, and has aspects around diagnostic accuracy. So our purpose of today isn't to necessarily focus on the statistics behind screening, but if you're looking for a good screening measure, making sure that there are aspects of sensitivity and specificity addressed, and making sure that it's identifying the right students. As it's related to supporting children from diverse backgrounds, we want to look at aspects like measurement and variance. So really thinking about differential item functioning, is that resulting in disproportionality in the resulting decisions we're making about students? Is the tool itself performing differently for students from different racial and ethnic backgrounds? And then finally, has your tool been normed and validated with the population of interest or groups of students that you're interested in working with? I know there's plenty of assessment tools out there right now and lots to choose from and to think about, but really looking at being a good consumer of data and selecting evidence-based measures. Do your measures have evidence for addressing issues of equity and fairness? And are they disproportionately identifying kids from marginalized backgrounds? So we'll talk about some of that today. It's important to note that in our field, we haven't, as Janine mentioned, historically done a great job of serving children from minoritized backgrounds who have behavior concerns. So if the goal of assessment is to consider, again, identification and in some places moving into placement, eligibility, and placement decisions for special education, statistics suggest and research has suggested for a long period of time that we have concerns with disproportionality. Partially due to unmet needs, kids aren't receiving the services they need, and that often has led for us to rely on special education as being the means by which kids receive services or supports unfortunately, in many schools. So when we talk about disproportionality in the identification for services refers to significant differences in classification relative to a group's proportion of the overall population. So we know that right now research suggests Black students are overrepresented in being identified as having an emotional disability. Oftentimes these Black students are identified two to three times more likely to be identified as having an emotional disability compared to their white peers. And Hispanic students are under-identified. So when we think about Latinx or Hispanic students that we work with, making sure that they have equal opportunities to receive access to services and supports as well. I actually worked with a school district in the southwestern part of the country where 85% of their students are Hispanic, and they were actually cited for overrepresentation of white students in ED classrooms. So this can look really different depending upon what part of the country that you're in and the demographics of the students that you're serving. But really thinking about, again, how do we begin to address some of these in our behavior assessment practices? So this slide looks familiar, was one that we looked at earlier in the presentation today. But let's think about it in terms of equity. If we think about two different methods by which schools use to identify students who might be at risk, right? Many schools have used positive behavior interventions and supports, PBIS, for a long period of time, and are doing things around office discipline referral data. Other schools have relied on universal screening, and maybe you're working in a school that does a little bit of both. So I want to share some information about those as two potential methods. So again, racial disparities would refer to disproportionate systemic variance in educational success, progress, and standings that manifests in better outcomes for white students than those who might be from racially or ethnically minoritized backgrounds. So it's important for us to think about what might be those racial and linguistic disparities when we think about screening. So when within this behavior context, what does that look like when we consider universal screening data? So I present here a case example. This is Thomas School District, and you can see the demographics of this district are listed here on this slide. I consulted with this district that had a history of PBIS implementation. In this model, right, many schools use their office discipline referral data to identify students who might be at risk. If students have, for example, 2 or more referrals to the office, they're found to be at risk, and schools use these data to determine which students potentially have access to services at their school. So this school was interested in using a screener to begin to think about more broadly what were the social, emotional, and behavioral needs of students, and how did that compare to the ODR data that they had historically relied on. So the next slide will show you, again, we were interested in examining how schools identified risk using the ODR method versus a social, emotional behavior screener. And what we found was that this district, when we looked at their data district-wide, was disproportionately identifying kids from racial and ethnic minoritized backgrounds, that regardless of the screener or use of ODR data, that we did see some levels of disproportionate identification. We found that, however, the ODR data was often at more disproportionate rates than screening data. We ran a logistic regression. We used our odds risk ratio data. So we have any researchers on the call, those were the methods that we used to get at this information. But this showed us that minority students were 3 times more likely to be identified as demonstrating social, emotional, and behavior risk, whereas screening data was found students who were from minoritized backgrounds were 1.5 times more likely to be identified. So certainly less likely, screening was less likely to show rates of disproportionality, but certainly that was still present. However, what was interesting about this data is when we really dug deeper and didn't just think about district-wide, because right, the district could look at this and say, okay, these are problematic data, we need to do something about this. But when we dug a little bit deeper and looked at differences at the school level, you can see that each school had a very different racial and ethnic makeup of their student body, right? So what we found in schools that had more diversity, that rates of disproportionality were reduced or wiped out altogether. So the schools here, school 1 and 2, that had majority minority student populations, we saw non-significant results for differences in identification of behavior concerns for white students as well as students from minoritized backgrounds. So this was our screening data here, and then this was our ODR data here in this final column. But when we go to schools 3 and 4, you can see that white students were the dominant student demographic in these 2 student populations, right? Our odds ratio became significant and problematic. And so again, this is where we saw that disproportionate identification of students. Our future research with that district has dove in a little bit deeper to consider additional school and classroom-wide variables that influence rates of identification and considered ways that students might be referred. Another question I've gotten when I've talked about these data before is people have asked questions about what was the makeup of the educators who worked at those schools, right? Was there a cultural match between the teachers in that building and the students that they were working at? And on the most part, there wasn't a difference between these 4 schools. The majority of teachers in these schools were predominantly white. However, we did wonder if this could be driven by other factors, such as teachers having more interactions or exposure to students from diverse backgrounds and communities and having levels of familiarity that might look different if that's something that you're not used to. But certainly, I would say this warrants additional research and certainly additional work in this area. I think as researchers, it's definitely on us to develop psychometrically sound tools that are free of bias. But certainly, I would also lean on schools to make tools are being used in an equitable manner. I'd say our team, and I know many of my colleagues around the country, are working to provide additional evidence around behavior assessment practices that are equitable for all youth, and really thinking about how these measures perform with students, with various students from different racial and ethnic demographic groups. Just checking our time here. I think we're doing okay. Just wanted to highlight 2 additional studies where we've dove into this a little bit deeper. The first paper here that you can see, we conducted research with schools that had a large number of Hispanic, immigrant, and refugee youth. And we're really interested in looking at the identification of social, emotional, and behavior risk among English language learners, right? We don't talk a lot necessarily around linguistic differences, and seeing it if there are differences in rates of identification, social, emotional, and behavior risk. And so what we found is actually there was no difference between ELL students and English-speaking students, and that we did find that age and gender were significant predictors of risk status among students who were non-English speakers, as well as those where English was their first language. And that aligns with much of the research that we see, that as kids get older, they're more likely to be identified as having behavior concerns, and that we still continue to see disparities in the number of boys who are identified as having behavior concerns. In the second paper, our team was really interested in looking at, does student race and ethnicity moderate the diagnostic accuracy of a screening measure using the social, academic, and emotional behavior risk screener, the SABRS, which is one of the measure out there. Specifically looking at, is the screener more or less accurate for certain student racial and ethnic subgroups? In this study, we had a sample of 730 students and 54 teachers from 4 Midwestern elementary schools. And we basically, our results here, we looked at too many of the details of this study, found that the SABRS demonstrated borderline to optimal sensitivity and specificity across student racial and ethnic groups and being able to predict risk status. And that diagnostic accuracy didn't vary across the groups in our study. And this paper was specifically looking at, we had a sample of white, Black, and Latinx students. And so we found that the measure performed similarly across all different groups of students. I'm very happy to see. But certainly, as I mentioned, additional work is needed in this area, and certainly would encourage you to consider some of these data and factors and looking at your own behavior assessment measures that you're using. Okay, so I will turn it back over to Janine.
Thank you. So as we make this shift, now you can hear, you've heard lots and lots of examples of the ways in which our bias can influence what happens in assessment. And you can see the outcomes that we don't want to keep perpetuating that. And so this last part of our presentation is really to talk about some of the culturally responsive assessment practices that you can do, so that you can fight back against that bias that our system perpetuates, as well as our own individual decisions, how they influence our final decisions. So I like this slide because I want to just identify what is culturally responsive versus what is not culturally responsive. And you can kind of see the ways in which we have historically practiced in the left side of this table here. So when we collect data from past records and we just replicate what was already there, that's not typically a culturally responsive practice. But if we do more cultural data collection, including understanding the heritage and the identity of a person, that's actually integrating more of what they bring, rather than just using a more simplified approach to collecting information about a person. And I'll give you ideas about what you should collect in shortly. Interviewing with standard interview questions, some that have been around, many protocols that have been around for many, many years that have not really taken into account cultural differences, and sticking with those practices without doing methodologies such as design-based interviewing, where you're doing interviewing that incorporates questions that help you get at the strengths, the cultural beliefs, and the values of a person. That's more culturally responsive to do a design-based interviewing process. Being task-oriented and transactional in your interactions with caregivers and youth, meaning you go in with an agenda, you strictly stick with that agenda, and you move on out. You learn nothing about them as a person, or them understanding or being able to engage in trust in you. That culturally responsive practice would include being more relationship focused and having a more deeply interpersonal style of interacting rather than transactional. Having strict standardized processes and inflexible, that I understand, especially in cognitive assessment, that's part of how we make it a valid assessment. However, when you're implementing such measures, one way that you can make it more culturally responsive is to be collaborative and flexible and creative in ways that are outside of the standardization process, meaning not violating standardized processes, but actually working around them in between subtests and before you begin and after, and then in interpreting the data, that being collaborative in the interpretation with the people that you're working with is a culturally responsive approach. Taking the perspective of the referring person, you already heard, we all have biases, and oftentimes, what Dr. Eklund said about teachers, being more likely, through using office discipline referrals, is being more likely to have patterns of disproportionality. If you only take the perspective of the referring person and not really integrating multiple perspectives, you lose the value of having multiple voices, and also honoring the perspectives of the child and family that oftentimes may differ from the referring person. Doing data interpretation without critical analysis. Unfortunately, there are folks that take the numbers and interpret the numbers and don't put them in context, and don't really integrate the information within the context of the individual of which they collected data on. Whereas a culturally responsive practice would include interpreting in the context of their heritage and identity and contextualizing it instead of just reporting back scores. And then finally, a standard approach for everyone. There are places that they have a standard assessment battery that's used, and they use that for everyone. And I don't believe that that's a culturally responsive practice, because some, as we know, that some of the measures that we choose are not representative of all groups of people, or not well representative. And they tend to put people in a box that they should not be in, because we have limited data on them. So a more personalized approach to assessment and intervention might mean an assessment battery will be tailored to the unique referral needs, as well as to the population that you are serving. So, as I mentioned, cultural data collection, that's kind of an important aspect of what we're evaluating. And so here's some main buckets that you may want to think about. That looking at the values and perceptions and beliefs of a child and their family is an important aspect to actually contextualize the data that you're collecting from standardized measures. Coming from a strengths perspective, asking questions about specific strengths, or trying to learn what those are and what are the interpersonal and cultural supports that they have access to. Assessing acculturation and the context of which they are living in is important, and I'll talk to you about acculturation and what that is. The environment, you want to have a sense of what is the actual environment compared to the educational environment, so that you have a real sense of what are the kinds of needs that might need to be addressed that are different than just in the classroom context. And then finally, looking at adverse childhood experiences and just having a sense of the impact of ongoing adverse childhood experiences, including experiences with discrimination and racism in different contexts, as well as the school context. So one other thing that I think is important to be thinking about is communication styles. And this is one of the variables that I think is important for us to recognize about ourselves, as well as the people that we're working with. And I love sharing this table here that's from Sue and Sue, Counseling the Culturally Diverse book, because what it does is it shows you the variability within individual groups of people. And then often, if you look at this in the context of your own communication styles, you may find that you fall in different columns based on who you're interacting with or what the context is, whether it's a work setting or personal setting. For me, I know that there are ways that I was raised that line up with one of these cultures. And then when I'm enacting or in a relationship with someone in my role as a psychologist, there are things that I had to unlearn to communicate, because that's the way in which in a professional environment you are to communicate. The reason why I point out this, you can see that it varies all across like speaking styles and how eye contact and what it means and the pattern of speaking and the intensity at which we speak. These are all important variables to consider because we make interpretations about other people and about their intent based on the way that we communicate. And so oftentimes there's lots of misunderstandings and misinterpretations of the behavior of youth as a result of different communication styles, including our own communication style. You may also see that when it comes to educators interacting with their students and there being a lack of communication, or not a lack, different communication and misinterpretation around that. So looking at things like this, I think, is important, and kind of know where your styles are and what you think when someone that's different from you or communicates different from you interacts with you. You might find that you might be off-put by some of the ways in which they're communicating. Another thing to think about, as I mentioned in a slide, 2 slides ago, was acculturation. And so I like showing, I feel like this is an easy model to kind of capture what acculturation is. What it is the way that we respond, or a person from a cultural group responds to an interaction to someone else, or when they are interacting with people from a different cultural group. So it's basically being exposed to another cultural group and how they respond or interact with it. So as you can look at these 2 arrows, and Barry developed this model where there are 4 quadrants, but I don't really see them as quadrants because people don't individually fall within one quadrant at a time. So I have arrows here to kind of describe a continuum. So going across when a person is preferring to learn and adopt a new culture, and you can see on the left side, that's more of their preference. Whereas on the right side, that's a person attempts to avoid or doing so. Now, vertically, you can see that there's a preference for keeping heritage and culture, native heritage and identity. And then going down, there is less of a preference. And so if you kind of see this as continuum in both directions, then I want to describe the 4 different styles. Assimilation is a style where a person does not prefer learning or adopting a new culture, and they prefer to adopt a new culture, and they don't prefer maintaining their native heritage. They basically give up their native heritage to get along and be connected and relate to other people. Going up at the top, above that, integration is where both are occurring, where they're maintaining their heritage and adopting a new culture at the same time. On the right side, separation is where there's a strong desire to maintain native heritage and not adopt the values or practices of a new culture. And individualism, they feel like an individual, they don't do either. what Barry found in his research is that assimilation has the most, it's the most stressful, and or what we call acculturative stress, and that is because a person is likely to have to give up their native heritage to get along or to feel connected to others in the community. If we don't have any sense of what acculturation is or how a person is adopting or responding to their environment, especially if they're one of few in a cultural context, it is very difficult to make decisions and understand what their needs are and how to make recommendations on how to support them if we don't know what their acculturation style is. So this is one of those silent struggles for BIPOC youth that I was mentioning, is that sometimes they may be having to feel like they need to assimilate in a context where they don't have the ability to maintain their native sense of self. So another tool that I have, there's 2 slides. So when you receive the slides, it'll be easier to read them all. But I created years ago some questions that are really helping inform our interview practices when we were interviewing individuals about themselves and trying to learn about their context. And I give you questions that you can ask in different domains. Pamela Hayes has a framework called Addressing Framework, and so that's an acronym that you see along the left. And I asked if I could anchor my questions on her framework to make it easier for people to kind of capture and understand ways to get at cultural understandings through interviewing. And so as you look through these questions, look and see which are ones that you might be a little less comfortable asking, and why. Ask yourself why. Because many times when you ask these questions, you get a much deeper understanding of the person and what their needs are. And they also get an understanding of the fact that you are a person that recognizes the importance of culturally responsive practices, and that you are in a space of valuing that. And so these 2 slides, this is the second slide that has the remainder of the addressing framework, and then additional questions that you can ask for each of the domains. And then in the notes at the bottom are 3 different papers that you can read that reveal kind of how using this interview schedule informed clinical studies that I had done. So last, before we get to the Q&A, I just want to remind us all that it's really important, if you are doing culturally responsive assessment practices, that you want to tell a child's authentic story through your reports. And so I have another tool that I'll share here that I use where before you start doing an assessment, you can plan on how you are going to translate some of these cultural factors into your report. And so on the each column, I just made sections that are kind of typical for a psychological assessment, and put in questions that you can think about before you begin, and how you will interpret them after. And so you can see for the background section things that you'd want to include, like the cultural values and cultural and or linguistic factors that might interpret or impact our learning and behavior, and acculturation patterns and styles among family members. So those things that I just shared with you, this tells you that's a place that you can locate that. And then when you're thinking about test selection, picking the right tests that actually are more representative, text interpretation, making sure that you are bringing in that background and interpreting the assessment tool, the tools that you used, and integrating strengths and assets and recommendations. So that's for the planning worksheet. And then there's an analysis worksheet. And so I do this with my students, where after they have written their report, they actually go back through and do an analysis to determine whether they actually integrated these things in the report. Because sometimes things are left in our head and we forget to put it on paper. And unfortunately, if it doesn't make it into paper after you're gone, it didn't happen. It doesn't exist anymore. So it's really good to actually think about, how do I could put this all in context for the next person that will work with these families. So that's a couple of tools for you to think about. And we're almost out of time. We have 5 minutes for questions. So I apologize for rushing through those last few things. And I guess we'll open it up from here.
Not at all. That was perfect. Let's move right into Q&A. We have actually quite a few that came in recently. Let's start at the beginning here. What tools would you say are available for identifying and acknowledging this type of awareness and understanding? So, Dr. Jones, you just gave us some really helpful worksheets. I wonder if the question here is, how do you help entire groups discuss their subjectivity and behavior assessment practices, or do you recommend that this be an individual process that educators go through?
That's a great question. I actually feel like it's both and that individually you need to do this, but I kind of facilitate professional learning communities where folks can do it together, because oftentimes there are people that will have a perspective that will help inform another colleague's perspective. And so being able to sit together and look at a child and make decisions around, what do you think this means in the context of this child's life? Having a buddy to do that is really helpful. And I've seen some really rich reports come out of doing a mini PLC with colleagues in the same way, using this tool.
Excellent. I think this is a really important question to try to clarify some of the stats that we gave at the beginning of the presentation and then how we referenced them throughout. One of our participants noted that she was confused because at the beginning we were saying that minoritized students were subject to more prejudice and trauma, that we need to keep that in mind as we work with this youth. So why wouldn't it also be the case that the same students would be identified more frequently? So Dr. Eklund, when you were talking about how oftentimes Black students are over-identified, doesn't that align with what we know to be true about trauma and prejudice behavior that we need to take into account when dealing with these students?
Yeah, and I appreciate you, Livy. I was looking at some of the questions around, how to select a screening measure to reduce implicit bias, or is there like a behavior assessment tool that you would say is better than others? And I think hopefully what you've heard throughout the presentation is you should never rely on one piece of data or one number or one source as being the be all end all in this process, that you have to consider lots of, including and most importantly, cultural factors that could potentially be a part of the student's life. I mean, I really resonated with Dr. Jones's focus on Barry's acculturation model and taking that into consideration when we think about where a youth is at and what type of school they attend and who there is part of their social group, and thinking about what is their connection with teachers at that school. Is there code switching that they're having to engage in drastically from moment to moment, and aspects of their functioning that are being impacted because of that. So yes, I get the point that certainly those rates could be elevated for lots of different reasons. But I think screening data itself is not diagnostic. It doesn't mean because we administer a screening measure that should take us from moving into direct individual and small group counseling with those students. That essentially alerts us as a red flag that, hey, there might be something more going on for this student, and we need to do some follow-up and talk as a team about what that might mean. It doesn't mean it's a direct connection to a mental health concern or a mental health problem. And it may be something, an environmental factor or cultural factor happening for that student that they need a connection to an adult to talk about that and process that. So I think, again, moving away from just one score, one source of data, and thinking about them more globally. But Janine, I don't know if you have other thoughts on that too.
We are at time. I'm going to ask one or two more questions for those that do want to stay on. But if you have to leave, we totally understand, and we appreciate your time today. Thank you for joining us. One question that I do think is important, and I know that we hear a lot, Dr. Eklund, is when districts are using universal screeners, they often only have one teacher that would deploy, let's say, like the Sabres, which is the universal screener that you referenced and that Illuminate Education provides. how should a school think about which teacher should be using that tool, right? If you have a middle school student who has multiple teachers that they see each day, which teacher is the correct one to be making the observations and doing the student rating?
Yeah, I mean, I think I kind of go back to, I don't know that there's just one source of data that would be like the absolute truth. I think as you get into working with older students, student self-report data is highly accurate, and having a student tell you what they think about their functioning and how they're doing, I would say is a great go-to. If you're thinking more about getting feedback from teachers, I think we rely a lot at the elementary level on who does the student spend the most time with and has gotten an opportunity to really connect with the student and can report on their behavior. I think at a middle school, you could think about a homeroom teacher or somebody, all English teachers maybe would complete data on a student. But again, really thinking about using that as one piece of data in a bigger picture about how we consider students functioning.
Excellent. And then last one before we wrap up here. Dr. Jones, I wonder if you might want to take this one. The question is that, teachers and counselors who are interested in examining their own biases will probably naturally more self-select to take webinars like this, to seek out the readings. What are effective ways to introduce these ideas to more closed-minded colleagues?
That's such a nice way to frame it, closed-minded colleagues.
I appreciated that too.
Yeah, I just kind of see everybody as people that can't help. They can't help it. And so the ways, if we don't, call out people, but we call them in, bring them into alternative perspectives, just point out, I do things in the form of questions oftentimes. So when I see someone exhibit a bias, I'll say, I wonder if there might be an alternative perspective here. So I might think this, or I might think like that. So I just kind of present it as another possibility or another option, so that it's really done so in a way that doesn't promote defensiveness, because that gets us nowhere. If offending someone or pointing someone out for their mistakes doesn't help at all. It doesn't help the children. It doesn't help us in our academic or colleague relationships. So just in doing so, by reminding that there might be another perspective, is oftentimes the easiest way to bring people into a new way of thinking.
Excellent. I love that. Thank you. Thank you all for attending today. We really appreciated your time. Excellent questions. I'm sorry we didn't get a chance to get to all of them, but as Dr. Eklund and Dr. Jones referenced, you will be receiving these slides, and there's a lot of additional information in the footnotes as in terms of what other papers you might want to read, what other books might be helpful for you as you're looking to go deeper into this topic. We also want to thank Illuminate Education for helping to co-sponsor this webinar. As you plan your behavior and SEL programming next year, do you know that the FastBridge assessment system can help ensure that all students in your district and schools receive a universal screener that can help with social, emotional, and behavioral support? And just a note that federal stimulus funding can be used and applied to all Illuminate products, including FastBridge, which is the assessment solution that offers the savers, which Dr. Eklund had talked about in her presentation. If you'd like to see more about how that system works, you can do so by visiting our website, fastbridge.org. Thank you for all of your time today, and have a wonderful day.